experience, and my book is right because many people are struggling and they do not know where to start, where to get help. So this is the first resource. Actually, it's the first of its kind in Uganda, and it has also a compilation of poetry for healing. I'm called to the healing space, so for me that is my heart. So I'm hoping my presentation is ready.
Right on time, right on time.
Yes. So Heart to Heart is really a mental health wellness support program. Slave trade abolitionists who said it's easier to build strong children than to repair broken men. And that is so true, because if we focus on building strong families, definitely we shall have less issues with our mental health challenges. So next slide. I want to tell my story in that it is under a minute, and so I'll give you a moment. Just look at it. Yeah, just play it. It's under 1 minute. No. Go to the next one. The 1 minute. That's why I did that. I wanted to help you understand just a little bit that when we come into the hospital, put a face to that person. We are not just numbers. We are actually people with families. We are people with husbands. We are people with jobs, and the struggle is real. For me, the background of my struggle is really about the strain I was having in my marriage at the time, and also childhood trauma, because I went through abuse growing up. I was raised in a polygamous family. Just a disclaimer, my dad was not a Muslim. He was an Anglican who chose to be polygamous. And while growing up, I was raised in a family where we were with my mom and my stepmom, same home, so the strains were real. And there, I just want to show you family. That is what has supported me. Family has by me, because family helps you to maneuver during the struggle. Yeah, so next slide. And so the program, the project description, it's about using peer support, because peer support is very affordable, and I just used that to show you how much I spent, and that is over 5 years ago, because I went off medication 2014. But that's how much I would spend on just one of the medications I was taking. That was sodium valproate. And I was not only taking that one, I was taking other medications. So that is to show you how much we spend when we are on the medical approach. And I'm not here to bash the medical system, because I know we need medicine at a certain point. There are times when you're in a crisis and you'll need that intervention. Sharing our lived experiences, iron sharpens iron. Family involvement definitely helps people when they are involved in the recovery programs as well. They are able to support loved ones better. Next slide. So the outcomes, like I said, because of this book, which I launched last year, we were able to increase mental health conversations, because when I remember 2009 and what things are now, there's definitely a big improvement. Everybody's talking mental health. We might not be there yet, but really it's a big improvement. At that time there was nothing. No one was talking mental health. No one, hardly. So for this to happen, we're able to have partnerships with Vision Group, which is a media house you all know, Ministry of Health, Britannica, they are all there. Out of this, again, the book project, were able to get the Ketura Mental Health Awards, and 3 awardees were recognized. And one of those 3 awardees is right here, that is Daniel. That one in the picture is called Joseph Atkunda. He's the first Ugandan to go public about his mental health challenge. Next slide. Another outcome, you can see us there, a group of people who meet to talk, share our stories. Some of the success stories, people have gotten married, people have started non-profit organizations. I heard her talk about Peer Nation. Peer Nation has been birthed because of peer support. I'm a co-founder of another organization called My Story Initiative. It has been birthed out of peer support. So that is to show you, and these are peer-led, peer-founded, right? And because we are taking up space, we are speaking for ourselves. We are self-advocates, and we are also advocating for other people. So the lessons learned, it's proven, and there are so many researchers, I didn't quote them, but I have put it there. Peer support works. It works. I'm a testimony of that. It works. And one of the studies which I was part of, actually that is the first one, Brain Gain 1. It's the first peer support pilot project in Uganda. Where Heart Sounds, Uganda at that time, I was part of it, were 36 peer support workers. We made over 500 home visits, and what you see today, we are a product. Me, I'm a product. And so just to build on that, family is very important, but also you, the person who is living through it, you need to learn to build resilience. And for me, part of my resilience, I will not lie, I'm a Bible believer. It has worked. I use the Bible to affirm myself, I speak over my self-life, and it has worked. The theme for this year, the Mental Health Awareness Month, is anxiety. For me, I'll counter that by saying, God has not given me a spirit of fear, but that of power, love, and a sound mind. Yeah, so and it's clear, when you support people, they thrive. Next slide. So call to action. We need government and other stakeholders to support mental health community programs. Because like the mental health awards I've talked about, really, we need people to hold our hands. We need people, like how they say you are a Moses, but you need Aarons, right? Because even being here, people have done things collectively. So we also need people to join the campaign. Mental health awareness is everybody's business. I keep saying that. And I was so happy that the Counseling Association, for the first time, I've never seen that, a psychosocial support team, the camera people, that is awesome. It was on point. And then we need people to respect the human rights of people with psychosocial disability during care, treatment, and after, the aftermath, dealing with the stigma. Because when when you stigmatize people, when you disrespect people, you treat them without dignity, that is a no-no. So next slide. The references, I use the Mental Health Innovation Network website, Heart Sounds Peer Support, my book. I forgot to put the link, but people who will want the link, I'll put it there, I'll share it. Breaking Free, and also press reports from Urban TV and Monitor. Thank you for listening to me, for God and my country.